Mr. Brown, you're up first.
Well, I've been talking ever since this campaign started about a new program in Houston, a vastly expanded network of neighborhood health clinics, particularly in those neighborhoods where the needs are greatest. And I mentioned before the Ready clinics, which Memorial Hermann still has. They didn't work in the indigent neighborhoods because people wouldn't spend $20 to go in there and see a healthcare professional or a doctor. I think it's got to be a very ambitious, coordinated program. A lot of what we do, unfortunately, is fragmented. I think a model we might look at is Denver Health, which is a coordinated network of expanded health clinics where families, mothers with sick children can take public transportation or conveniently walk and see a doctor or a healthcare professional that they recognize and that can keep their records and really keep their family safe. If that access is available, I'm talking about the delivery end now, not the insurance end. If that access is available, fewer and fewer people will go to the emergency room. And I don't see any other way to do it, to work at it at the delivery end. And I think we can make a success out of that in Houston as they have in other cities like Denver.
One of the things that I would certainly do is maintain, and I try to expand, the existing city program called Tele-Nurse, where basically you can take emergency calls and see if a nurse can treat those as opposed to having someone go to an emergency ward. So that's number one. Number two, we have to expand the network of neighborhood clinics. And we've got to play a role in that process, make sure that we get federal funds for clinics, and the city plays a role. Number three, it would be a great idea if, as a part of our wellness program, we can expand the role of school nurses so that children are at least checked, so that we can make some determination if there are budding problems at the school because they become epidemics. And the final thing is, I think it's very, very important that we use the network of institutions where people are. The people are creatures of habit and they're creatures of comfort. And when somebody is in a neighborhood and they're comfortable in their neighborhood, rather than expecting them to come to you, you go to them. So we need healthcare diagnosticians and providers working through a network of churches and neighborhood centers, trying to work with people on wellness and good health.
You know, our ERs have been in a crisis for years. And it really starts with the problem with the federal government. Our government has two choices. One, they have to control our border, or two, they need to be able to come up with a program to have a work profile or work plan for undocumented workers who are taking up a lot of our ERs today. We've got to be able to fix that. But it's got to be the federal government that we turn to first for that. Secondly, we have those that are in poverty. They have no other means of getting just basic general health check. That's why we need to also include many of our neighborhood centers that we have now that provide care to all of our communities, like neighborhood centers over on the East End. We can do that, but we need the public, we need the private sector to also be able to contribute to this.
Well, it's been mentioned several times before, the city has a role in our city clinics. We do preventive care. We need more of those city clinics. We need to expand throughout the neighborhoods in Houston. Our Tele-Nurse is a great program, and we could do more of it. But we have been a big contributor to the problem of non-emergency patients showing up in the emergency rooms, and that's through our ambulance service. We need to do a better job of dealing with people on the street. There are a lot of frequent flyers out there who call a city ambulance because they think they get treated better and faster when they go to the hospital if they're in a city ambulance, when they could perfectly well get there on their own. That's one issue we're trying to deal with in the city. And the other is that a lot of folks call a city ambulance when they just need to go to the to pick up their meds, they need a regular appointment with their doctor, they're doing their normal health care. It's actually cheaper for us to pay a taxi to take somebody to the hospital than to transport them in an ambulance. We are focusing very hard on that particular issue to keep people out of the emergency rooms that don't belong there and to do a better job with the healthcare dollars that we spend on ambulance transportation.